our emergency department, as well as the other three hospitals in UW-Medicine, are all preparing for what we call surge. And surge is when we have a significant increase in demand, especially from similar complaints as we anticipate with COVID-19, where we know when those patients are infected, they have what everybody's been reading about, which is cough and fever and sore throat and things like that. And so it's building, we are all building a space to meet the demand of that respiratory illness that comes along with COVID-19, as well as other things that can cause that, like influenza, which is in our community right now too. The respiratory clinic is kind of what we're calling it in Harborview's case. It'll be staffed by a combination of emergency medicine's physicians and advanced practice providers, as well as some of our great doctors from our acute care clinics, or folks who are used to taking care of sick people, but usually in more of a clinic environment, as you would do when you go to see your doctor for your checkups and such. The tents allow us to expand what our capabilities. It allows us to expand the number of patients we're able to see. And we hope not to have to use it extensively, but we are all looking at the projections where we know we need to prepare. And so this allows us to expand those capabilities, but it also allows us to kind of bring together or even cohort patients into a similar area. And that way we can make things more efficient for them, to where they get exactly what they need in a shorter period of time, instead of coming through the emergency department process where we take all comers at all times. And so there's efficiencies if we can cohort patients with similar illnesses in one location, making sure at the same time we're being safe at the same time. This will become operational sometime over the weekend or early next week. Each hospital is at a little bit different planning stage and operational stage. And how it will work is essentially patients will come to the emergency department as they normally would, and they'll be met and greeted by one of our triage nurses, who will ask them some questions and then decide, boy, is this somebody who has a regular complaint, because we're still seeing folks with heart attacks and strokes and trauma and those, but it allows us to sort those patients into the main part of the emergency department, or an extra area that we're building with our tents to bring those people together into one location with the common complaints that we know they present with the respiratory illness. So a patient coming with respiratory illness to the emergency department would be again greeted, and then they would see a physician or an advanced practice provider who would evaluate their complaints, and if additional testing is needed, we'd be able to provide that, whether that be laboratory testing, swabbing, even X-ray. Where in Harborview's situation, we're going to have access to an X-ray should that be clinically indicated with what's going on. So if somebody's really sick or needs to be hospitalized, then we would again greet them in front and move them rather quickly to sort of the core or main part of our emergency departments. And just like happens today, and just like happens with other illnesses, they're greeted by an emergency physician and our great nursing staff, and whatever care is needed will be provided there. And we're fully functional and operational, and our goal is to maintain that level of commitment for people with severe illness all the way through this entire pandemic. We know that there are emerging infections that are occurring. You know, we've been through the Ebola reality, and that's a very different thing than COVID. But we are constantly planning in the background how we would respond to those events. That being said, we do not plan on having a tent in front of our emergency department for any longer period of time than we really need to. But it's absolutely necessary during this time.